Welcome everyone. Hope you all can see me well. If you can see me and hear me well, just message me a hi. Hi Urmi. Hello everyone. Okay, great. Thank you so much for joining in today's Health Talks with Experts. Quick check. I hope you can all hear me well. Yeah. Thank you. Thank you so much. So I welcome you all in today's Health Talks with Health Talks with Experts, and I'm really happy and excited to share about today's celebrity panelist. But before that, I welcome you all. Thank you so much for joining in. Truly acknowledge that Sunday afternoon 4 p.m. But still, you all are here, and that shows your commitment to work on your health and fitness. I truly appreciate that, every one of yours. So first of all, a big warm welcome to each and every one of you for making it. And in meanwhile, I would also request you, if you can just share the link with your family members or any contact you think they should also be listening, because today's topic is very relevant, and anyone in and every one of us in any time of our in our life must have faced this issue, that is back pain. How many of you really feel that at any point of time in life, for sure you have experienced back pain? And if you are still having back pain, just message me here, still BP, back pain, still BP. Or sometimes you may not be having severe back pain now, then also you can message here BP. Still having. Who all are having? Just let me know quickly. Quickly message here, everyone. Great. Thank you. Thank you so much for sharing. And now let me just quickly share. How many of you are joining Health Talks for the first time? Just message me here FT first time. Just message here FT first time if you're joining for the first time. Okay, so just to share with you how it started in June 2020, Health Talks with Expert. It's a platform that I have created that time to bring wellness experts to come here and share their knowledge and wisdom with every one of you, so that people can overcome their health challenges. Every month I bring uh, any one experts. I try bringing, depending upon I sometimes do survey also. So we have had a lot of doctors, healers, health coaches, forgiveness coaches, sujok therapists, Ayurveda doctors, so many different sound healers. Yeah, different variety of healers have come to our community, as well as to this Health Talk space. And this is also a part of our silver membership program, also this Health Talks with Experts. However, it is open for everyone, and everyone can also watch this video on YouTube also. So thank you so much. A quick introduction about me. I'm Yukti Raj Kishore. I'm a breath coach. I'm a founder of Yuktinist, and I'm a certified Nirvana Fitness Ambassador, wellness coach, flow coach, and I have done various certification in the field of yoga. I have quit my high paying job because I found my purpose, my solace in spreading breath awareness. That is the most ignorant part when it comes to your health. People are not aware of it. And this is my mission, to help people to breathe right, breathe consciously, and attain mental peace, overcome their stress and anxiety issues, and lead a very healthy, happy, purposeful life. Yeah. So thank you all. Thank you so much. Now, without any further delay, I would like to introduce our celebrity panelist. Priya, let me just bring her here. Before that, let me just share her profile also. Yeah, so she is a back pain reversal coach. She has done MSc Family and Community Science, diploma and MA in Yoga from Human Excellence, PGDYT, Yoga Therapy, SVYASA, Bangalore, Diploma in Acupuncture Science, Jain University, Bangalore, Basic and Advanced Siddha Mudra Therapy, London Batch Flower Therapy, Magnetic Therapy, Color Therapy, Sujok, Seed, Reiki Healing, and a lot more. She's also on a mission to help people to get rid of their back pain. Besides that, though she has a very good knowledge of the overall yoga, but she has chosen this niche. So let us bring her here on screen and let's talk about how she started her journey, what made her to come in this area, as well as what she's gonna teach us today. So welcome, Priya Mohan. Very, very warm welcome to you. Yeah, you can unmute and speak. Yeah.
Yeah, first of all, I thank you, Yukti, for bringing me here and giving me this opportunity and to share my knowledge to people, to help people. And that is my mission, to help people with back pain who are suffering, because this is my micro niche and I've done my yoga therapy, but people with the back pain has made me an impact to help them, because I've seen most of the people around me, even in regular life, even I used to suffer with back pain. So we have to live with that. That is not a big issue, because we could go and take some rest or something like that. But we have to live with that. So we have to face the issue also, and we have to do a regular course. So that made me to mostly women are affected by that one. And they have to do their regular things also, taking care of the family and taking care of their regular work and all those things. So during pregnancy and during normal times and all those things, even now, irregular of their male or female, both are affected by back pain. And mainly female, they couldn't take any rest also, having this issue. So that bothered me a lot, and thought of helping those people who are suffering from back pain, especially. So I chose this niche. I've helped a lot of people to come out of these problems, and they are proceeding well with their regular life, and many have come out of their surgery conditions also. So that is, I'm very, very happy. And I'm very thankful for the people who have come here, and my gurus, and also my mentor, Dr. Rakesh Deshpute, and my family and my friends. Because of them, I'm here.
Thank you.
Thank you.
Thank you. Thank you so much. So we would like to know, first of all, that why do you think, what are the main reasons of back pain? Can you just throw some light over this, that people are suffering from back pain? What are the types and how they can manage their back pains? And is there some remedies that you can share with people here? And yes, every one of us, those who are here, make sure that you be ready with your questions. Yeah, we'll be taking a Q&A towards the end, and we will be doing a breathwork practice also. That can also help you. In fact, yesterday only I've posted a video also on body pain relief. You can check out later that, not now. Here, now, we will focus here and learn from our health panelist, Priya Mohan. Go ahead, Priya.
Yeah, thank you for giving me the opportunity. I will start now. Actually, back pain, no, each and every day, each one of us, sometime of our life, we have experienced back pain. When we were four-legged animal, our whole body weight were balanced with four parts of the body, two legs and the four legs, four part of the body. And so we did not have a spine was like this, horizontal. And so we did not have any stress on our spine. But after becoming an human being, we have to balance only, our balance area has become very short between both of our legs. So all the stress related to our weight and our body have to be balanced with our back. That is the spine. Only the spine and the lower spine muscles have to give us the strength to balance our body as well as our whole shape of the body. So there are many causes for back pain. Usually, the main causes are In yogic culture, we take it as two types, main types, two types as the Adija type, the Anadija. Adija is stress, stress related back pain. The other one is Anadija, that is non-stress, that is related to the body structure, change in structural patterns, and all those things are listed under Anadija. So let us come towards the non-stress pattern first. Because this is the most commonly seen, prevented in the today's field. We commonly see only this type of thing. People are able to relate to that type of pain because this is the main cause, and the main cause for this one is injuries. So we are often meet with an a bike injury or a car injury, or just by sitting down rashly, we get a pain in the lower back, pain starts. The other one is we are going for what we are meeting with injuries and some what type of some what will have some body related nerve stresses, and also some what some type of we'll get some what to say. So all things related that can be judged through the blood test, and also through some MRIs and scans and all those things, which were able to see it with our eyes, with the type, with the with the tests, and medically that could be seen. All those things come under the functional thing. Here, the structure of the spine is altered. So it could be due to infections. Some tumors may be there. All those things may be the cause for the Anadija, that is non-stress related back pain. The other one is the main thing which we cannot identify using this type of any type of that is tests, blood test or anything like that, because it is mind related, it is stress related. So people actually what we mean by stress is it's not a big thing. See, usually what happens in a body, stress is defined as the thing which we are not able to handle. It differs from person to person. See, a simple thing might be a stress for me, and it would be a rather very easy thing for the other person. So stress is not a particular thing that which you can define. It differs from each person. When you are too much stressed, what happens? Stress-related hormones like adrenaline, it is produced, and so a fright or flight related situation is created. When this one is created, the muscles become very tight, and lots of glucose are produced to that muscles to run away from that situation or fight against that situation. So when you are coming out of that situation, for example, if you are seeing a snake, if a dog is chasing you, you'll run like anything. But after some time, when that incident is over, you'll return to normal conditions, where anti-stress hormones will be released like noradrenaline, so that your stress condition will be relieved and your muscles will become very flexible and you'll be in a normal situation. But in today's lifestyle, what is happening is from morning to evening, you're always stressed. The stress level is not just once or twice. For 100 times a day, for each and every small thing you are facing, you are stressed, irrespective of your age. Even a small kid going to a KG, he's telling that I'm very much stressed, I'm tensed. So what happens is always your body is under a stress level and adrenaline is always produced. So your muscles are extravagant, it is very in a spasm condition. So it is always very stiff. So what happens is, usually we think that back pain is coming due to the problem in the spine bone, but that is very small percentage. But the main cause is the muscles that is giving the structure and that is providing the strength to that back spine bones. No, that one, the muscles surrounding the spine, those are the main reasons for the back pain. Because if that spine muscles are not strengthened and your core muscles are also weak and spine muscles are also weak, all the weight and all the stress go directly towards your spine, lower spine especially. So automatically wear and tear starts there. So it leads to back pain. So this is the main cause for back pain. So which is seen in the structure, which can be judged using the tests, MRI scans, and all those things could be cleared using these medicines, surgeries, and sometimes. But usually in yoga, we prefer it to be doing stretches, breathing exercises, and also giving regular strengthening to the lower spine muscles. You could reverse those conditions. So these are the main causes for back pain. And then going to the types of back pain. So we'll be thinking that back pain means it is a single type. You mean that back pain in the back? No, it's not like that. There are many types of back pain. So you have to think it over yourself. The first thing is, it is due to some slip disc or herniated disc. That means the 33 vertebrae are there in our body. That spine bones are of 33 in counts. And there is a disc, a cushion like jelly-like substance in between the two vertebrae bones. So in between that, there is a cushion which helps to prevent the muscles, bones to be crashing with one another. So what happens when the wear and tear happens in this part of the muscle, this cushion in between, that the vertebrae that compresses the cushion, what happens, that cushion comes out there. Then the nerves which is coming out of the spine, which is taking the sympathetic and parasympathetic nerves to the brain, that nerves are just pressed by this cushion, which is coming out of the bones, that two bones. So that herniated disc, that is called a slip disc. In that one, you will get sharp pain at your lower back, and also numbness in your soles and calf muscles. You'll get numbness. So that is called as disc prolapse or herniated disc. Back pain due to that one. The second one is sciatica pain. That is most common. And here the sciatica is a bunch of nerves that is coming out from the lower part of the spine. So on the both sides, the spine is like this, and the lower part, both sides, from the spine, a bunch of nerves are coming out. So that is called a sciatic nerve. Due to this herniated disc or some other spur in the disc, which presses this sciatic nerve, this creates some pain or numbness on any one side of the body, either right side or the left side. So that you will get pain or tingling pain from the hip towards it radiates towards your toe. So that type of pain, it depends on which nerve is being compressed. So whether it is your S1 nerve or L5, L4, which disc is compressing and which nerve is being compressed, depending on that, the radiating pain will vary. So that is called as sciatica. Then next one is cauda equina. Here, a sudden compression happens in all the nerves. The lower part of the pelvic area on the back side, all the nerves are compressed suddenly due to some unknown reasons. Here, you will not be able to, your incontinence in urination, your bowel movement, and all those things will not be able to bear, will not be able to control your urination or bowel movement. That is a very emergency situation. That is very, very rare also. And here, how could you diagnose this one is, this sciatica pain will be known on both the left and right. It will be, you will feel the sciatica pain on both the sides. In sciatica, you will feel only on one side. But here in this cauda equina, that's an emergency condition, you will feel the pain on both sides of the legs. That is called as cauda equina, that condition. The other one is the last one.
Just a sec. Priya, just a sec. Yeah. A quick check with everyone. Are you all making notes? Are you all making notes? Very important. Are you all making notes? Because I will ask questions. Ma'am will take a test for all of you. Ma'am will take a test. I will give the marks also. Winners will get the prizes. Yes? Yeah. Make proper notes. This information, not even the doctors are going to tell you. Or आप लोग सब YouTube पे छानते रहेंगे, and you will be keep on doing. You are getting authentic information. Please make sure that you take full information and make proper notes and be sincere. Keep taking notes. Thank you. Thank you so much. Continue.
Yeah, I'll tell the other form, then I'll just give you a review of the 4 types of back pain. Yeah, don't worry. Yeah, I'll do it.
And do ask questions also, whether they are learning or not.
Sure. Yeah, the last one is piriformis syndrome. Piriformis is a type of muscle, flat muscle that is starting from the lower back and the backside of the pelvic area that is moving above the sciatica nerve. So that type of muscle, that is the flat and the largest muscle, and that helps in the movement of both the legs. That is the main muscle that is helping to the movement of our legs. So when that muscle is affected, or the sciatic nerve under that muscle is affected, you will get that type of back pain. That is called as piriformis syndrome. So actually, there are 4 types of back pain. Just I'll repeat it. See, I have given a PDF. You can review with that PDF. You will be coming to know everything regarding the back pain. This is just an explanation for you so that you could just listen. Yeah, the first one is herniated disc or disc prolapse. Here the pain is very sharp. It is felt only at the lower back. And sometimes numbness is felt at the calf area and also your soles of the feet. So this is called as the disc is coming out of its main area. In between it is compressed by the 2 vertebrae bones. So the nerve coming out from the vertebrae is being compressed, and so pain starts. That is called as herniated disc or disc prolapse. The second type is sciatica. That is a bunch of muscle nerves that is coming out of the lower pelvic area on the both sides of the lower back. And depending upon the which nerve is pressed, the symptoms may vary. It will take some may feel some tingling pain in the upper thigh and the inner side of the thigh. Some will have some pain in the numbness in the leg area to the foot, everything. It depends upon which nerve is being compressed. That compression will be due to this herniated disc or some spur in the vertebrae area. So this is called sciatica, and mainly sciatica will get only in any one side of the body. Either it may be on the, you will be feeling it on the left side or on the right side. The other one is cauda equina, where that is a very severe condition. That is very rare also. That is not very frequent. That is very rare. You could not do anything. That you will have incontinence of urination, bowel movement, and also during the sexual ejaculation also will not be in the control. So everything will be affected, and that is called cauda equina, where sciatica pain will be felt on both sides of the legs. So both sides of the sciatica nerves, all the nerves in the lower part of the spine will be compressed suddenly due to some unknown reasons. So that is the main reason for that one. And the last one is we are going for the cauda piriformis. Piriformis is due to the muscle pain. That is the longest muscle, and it is very flat muscle that is covering the sciatica nerve, and it is responsible for the movement of the leg movement in both the legs. It helps in the movement of the leg. So when that is affected, you will feel the pain, and also the sciatica nerve will also be compressed, and this muscle will also be affected. So that is called as piriformis syndrome, and this is usually due to the muscle is not very much strengthened, and due to stiffness in the lower back, everything happens due to this. So these are the 4 types of back pain. Usually, normally people are felt with these 4 types. Even piriformis is a little rare. The first 2 herniated disc and the second one sciatica is the most commonly felt. And see, the test for how to identify whether you are having a back pain or some other thing. Even kidney related problems, you will be having pain in the back pain area only. So sometimes you will be confused whether you are having a back pain or something, the pain related to a kidney. So you can just easily diagnose it by yourself. So by lying down, you have to raise your leg. This is called as straight leg raise test. So you are lying like this, your leg is like this straight. And when you're lifting your leg up to 30 degrees, see, this is 30, this is 0, and this is 30, and this is 90. So when you're raising your leg up to 30 degrees, from 30 to 70, 30 to 70 angle, in this degree, if you're feeling some pain, if you're feeling some discomfort in your lower back or under your knee, anywhere, pain in your leg, if you're not able to raise your leg from 30 to 70 degrees, that means you're having back pain that is related to back pain. So you have to sorry, just a minute, just excuse me. Yeah, sorry for the break, because some time of noise is there. I've just muted it. Yeah.
Continue.
Yeah, this is the main reason. And the next thing what we are going to see with the thing is how to manage. We have seen the reasons for back pain, which is stress related and non-stress related. So stress related is called as functional, and non-stress related is called as your structural changes, which can be seen and which can be detected through what all type of tests that we can be done. So this is the thing. Then the next one is the types of back pain, and the last one is, now we are going to speak about the how to manage back pain, tips to manage. Actually, back pain is very common. If we have a body part, it will get somewhat disturbed at any point of the time. When age is going on and the cells are becoming little old, it is common. So how to manage? We should know how to manage back pain. So, first of all, the main thing is you have to prevent it rather than taking a treatment for that one. So prevention is better than cure. So first of all, you have to know about back pain, because your spine is the main organ which we are talking very less about it. We know everything about our hands, legs, we talk about our liver and all the organs, but about the spine, it is very rare. Because it is in the back, and we don't, unless it is giving some pain, we don't care about our spine. So first we should know about a little about our spine. So we should know about it. And when we are getting some type of discomfort there, we should go and refer something to know what is that. And so always prevention is better than going for the cure. The next point for going for the tip is, you have to know the postures. Mostly you get back pain in younger age because of the postural non-postural things, because your regular pose is disturbed. Your spine is like an S-shaped thing. So that is a normal posture of your spine. If that is disturbed by you, because you don't have a correct pose by when you're sitting, standing, or lying down, or while traveling anywhere, you're just ruining your back, your spine. So little by little you will get stress over it, and then when it becomes a habit, so when you commonly use a pose, it will become a habit in some 1 week or 10 days. Then you will be having the same poses. Even today, school students, when they're carrying the bag, lots of weight, and it is just coming at the lower back. So pressure is fully on the lower back. So we should know how to have the correct posture. So do you know how do we sit? The sitting posture must be just erect, and your working table should have your system or your laptop just at your eyesight. It shouldn't be too high, it shouldn't be too low. But nowadays we are having mobiles and we are always seeing like this. So we always hurt our cervical bones. Otherwise, we just lie down and just we look at our mobile like this. So there also we are getting the postural incorrection. So this is the main reason for, common reason for back pain, because everyone are getting back pain due to this posture corrections only. So you should know how to sit properly. So sit properly. Otherwise, if you're having some type of back pain or some disturbances at your back, you can have just a small cushion or pillow at your lower back, because this S type, that should be supported with some support, like a cushion or something like that, rather than you're sitting like this, having a hump here. So you should correct your posture. Your shoulders should be like this, straight and relaxed. You should not make it very stiff or something like that. you have to be very relaxed and keep your shoulders straight like this, not like this. It should be like this. And your lower back should be supported some small type of cushion or some pillow like that. While in a regular sitting posture or while traveling also. Even while traveling in a car, you should wear your seat belt. Where in case if you're putting a sudden brake or playing a sudden brake, your first thing is affected is your spine. Sudden compression on your spine will happen. So that is called as whiplash injury. In injuries it comes. So suddenly what happens, either your cervical bone or your lower back is affected. So that has to be noted, and you have to put your seat belt, and also your seat posture must be corrected. The seat position must be, you should manage it accordingly so that your seat is correctly making your spine straight, keeping your spine erect. So during a short travel, that doesn't matter a lot. But when you're taking a long travel of 1 hour or 2 hours, it should be taken into account. So you should keep some here, you can manage it with some pillows here and your lower back. So if you're doing that one, that is okay. And you can take a small break when you're traveling for 1 hour and half an hour. You can just come out and then have just little stretch. Then you can continue. Have some water, just relax your mind. Then you can go for the travel. So this is regarding the sitting posture. And then lying down posture, when you're lying down, if you're having back pain, you should have a small pillow at your lower back. Just a small pillow or a turkey towel. You could give the support there. And also when you're lying down at this, either on your left or on your right, you should have a pillow within between your knees. You can bend your knees and have a pillow in between your knees so that it can support your lower back. The stress must not, your body weight and the stress must not go and compress your lower back. So in that way, you have to keep a small pillow in between your knee, both the knee, when you're lying on your left or right. When you're lying straight flat on your back, you can keep just a cushion under your lower back. Mostly when you're lying on your stomach, that is not advised. So don't sleep on your stomach. If you're doing so, you could also give a support under your stomach. So these are the lying down positions that you have to take care of. Then you have to see also your bed, your cushion. See, if it is a new bed or new mattress, that is not a problem. But if it is at 1 or 2 years old, what happens? Our weight will be more at your hip area, and that position of the bed will be little lower than the head position. So you have to take care, look at that also, whether your bed is at a proper position. So that is also you have to take care. So these are the postural corrections you have to do. Then the next one is regarding your stress. Yeah, stress is the most common cause. Sometimes we will not be having any structural changes, but we'll experience pain, acute pains. Suddenly you'll have some pain. Then after some time, it will go off. If you just look at that, you have to take some rest. The main thing is rest. Take rest. When you feel pain at your back, just go and lie down. Lie down in the correct posture. So when you're taking rest, it's not only giving rest to the body, but also to your mind. Because due to so much of stress only, your lower back muscles are stiffened. Exaggerated stiffness of the lower back muscle leads to the pain. And so if you're going for a resting position, then your mind will relax, body will relax, and the muscles also at the lower back will relax. Automatically, within 1 or 2 days, you will get out of the pain, if it is an acute pain. So when you are resting, you should not just lie down, then keep on thinking over something. You should go within yourself. Should take some time, think about the incidents that took place the day or the day before. What made you to get that back pain? Is it because of your stress levels or some work you have done, suddenly lifting a weight, or because of your postural thing, or because of the stress that you are experienced? So while lying down in the rest, just relax yourself, just think over it, go inside yourself, relax deeply. Automatically your muscles will be relaxed and will come to a normal, the pain will reduce. Then the next one is you have to exercise. See, any part of the body needs to be exercised. That too, our muscles, when compared to our ancestral muscles, we are having a very, very weak muscles when compared to our ancestors, because they were working hard. They had so many physical work, everything were done physically. So their muscles were very strong compared to our muscles. Nowadays, we are having everything, all machineries, and we are having everything. We don't have to work for ourselves. But in those days, people used to work for themselves physically so much. So that when you work out, your muscles get strengthened. So you have to work on your muscles. You should not overwork also, and you should not underwork also. It should be like you should give certain work to your each and every part of the body. You should go for a regular routine regime of some exercises like yoga, walking, gym, according to your flexibility. You can have it. But instead, if you keep your muscles without working out, it will become weak day by day. And again, the problem will start. So regular exercising and also keeping yourself hydrated, taking lots of water, and also taking, we'll keep that cushion in between the jelly like thing. It will be hydrated. So it will be very, very flexible also. It will give some flexibility to that part. So overall hydration will help in reducing the back pain. And also this stress is very, very important, as this is a major thing in yogic culture. We see the reason for back pain. So when you are practicing some type of meditation or some type of each person will have some relaxation techniques. So if someone is hearing a pleasant song which they like, their stress will be reduced. When you are going out with nature for some vacations or something like that, your stress will get reduced. So being with nature or giving a rest to the regular schedule, you could take a little break from that one. You could go for a movie, some type of relaxation to your mind and body is really necessary to come out of this stress. So these are the tips to manage this back pain. And yeah, we'll see in Q&A session if you have any doubts in those things. Yeah, I think now we have, I've got some idea regarding the how to manage this back pain. Yeah, if you're having chronic back pain, you have to go for some type of regular regime or regular person who is dealing with that one. And you can go for some physiotherapist or some yoga coaches or something like that, so that you could do it rightly, to do some right exercises. So that could be done. So these are the tips to manage. Yeah.
Okay. Thank you. Thank you so much, Priya. Anyone has any questions, please feel free to ask. Now we will take some Q&A. You can type in or just, yeah, better you can type in only. Okay, meanwhile, can you share some, the practical, some acupressure, massages or anything, the points or the mudras that can help here all people?
Yeah, but Dimple has asked me a question that silicone hot packs, can it help? Yeah, sure. Actually, you have to experience both. First, you have to keep some ice packs. So massaging with some ice and then leaving an interval of 10 minutes, then give a hot pack. So that would help rather only with hot. Because if there is some pain or some inflammation, that will go away with some cold packs. Okay. Then if you're having some problem in circulation, blood is not flowing well, your nerve is compressed a lot, if you're having problem, tingling effect and all those things, in that thing, you can apply some hot packs. Yeah. Actually, when you
so the question is, I used to have lower back pain many times when I used to sit on chair for long hours. Can you please refer something? Yeah, of course, someone. Yeah, please go ahead, Priya.
Yeah, actually, when you sit for a longer time, maybe sitting or standing, anything, lying down too. If you lie down for a week, you'll get back pain. So what is the thing is, you should not give too much of stress to your back continuously. So you have to just get up, just go for a single thing. You can just stretch a little. You can just sit in sitting position. You can have some stretches like that. You can go for something like that. You can balance your lower back with some cushion. You make your position, sitting position comfortable, and also a right sitting position. That would help a lot. So you can manage.
Okay,
Those,
now
uh,
then the next question is in periods and PMS, why there is back pain?
yeah, actually, it is during periods you'll be having some your uterus is there that is just before your spine. Your spine, pelvic area, and your genital area are just one on one. So when your uterus during your periods time, your uterus will be sometimes it will be a little bulging. It will just come out, and also some imbalances in your hormone levels will happen. So stress that will create some stress. So the stress will automatically lead to some back pain due to the periods blotting or periods pain, and also the little of bulging of the uterus that will create some stress on the nerves on the back. So that may create back pain, and also the hormone imbalances that will create. Yeah, that time you
Okay,
have to
so
relax, and you can use this packs, hot and cold packs. You can use that one.
next question is cervical spondylitis leading to neurologic pain. Whether mudras and yoga will help out.
Sure, sure. Yeah. The same thing, what I said for the lower back pain is the same thing related to your cervical area also. The spine is composed of 33 bones. So here you have 7 bones in cervical area. So same thing, your head area is fully balanced by your cervical area. So when compression happens here related to your, as far in the lower back you are having in the leg, your arms will be frozen shoulder, tennis elbow, and your wrist, all everything will be affected by the compression of the cervical vertebrae. So in yoga, we have so many stretches and so many asanas, and also breathing techniques and everything, even meditation, everything will get the regular replacement of the compression that has gone through your cervical area. It will really help a lot. People have come out of it.
Okay, Jaya is asking one question is there. I have hot sensations in my thigh. Can you please tell me why it is happening?
Pardon, can you repeat the question?
Um, Jaya, can you please elaborate a bit because that would be better. She's saying that I have hot sensations in my thigh. Can you please tell me why it is happening? I have no idea about this.
Hot sensations.
Yeah, hot sensation, she's saying.
Yeah, depends upon the age. Sometimes when you're in your what is your age? Jaya, can I know?
Jaya, can you please share your age? 44.
Yeah, that's the reason. See, during your menopause stage, that is pre-menopause, menopause, and post. In those period, you'll be having some hormone imbalances. Your estrogen, progesterone levels will go up and come down. So you'll be having some hot flashes. Suddenly, you'll be having some chillness over your body. Everything will happen due to this menopause. That is the main reason for that hormone imbalances. Even yoga is helping a lot in those areas. So when you have a regular stretching and stress relieving meditations and all those things, yeah, it is helping. It is due to that one. Hormonal
Okay,
changes.
Reena, yeah, next is Reena's question. I'm suffering right shoulder, spine, back pain 24 hours. I took physiotherapy also and was relaxed, but again, it's happening if I left. Also, what is fibromyalgia? As doctor said that I am supposed to have that. Yeah.
No,
So she's
actually,
suffering basically with the right shoulder, spine, and back pain 24 hours.
yeah, actually, what is happening is, see, this is a management. Sometimes that's what I told. Even if it is okay with your spine, if you're not relieved from your stress level, see, when you're going for
Hmm.
physio or when you're going for medications, it will deal only with your physical structures. You should check yourself whether you are affected with some type of stress. So this stress may increase your pain because how stress affects our body is genetically we will be weak in some areas, our body. So when you are getting stress, what happens is the nadi that is passing through the prana that is going to your body in those area which is genetically weak will get affected. their blood flow, heat flow, air flow, and pranic energy flow will be affected. So automatically the cells in that area, they won't get enough food or oxygen or prana. So automatically it will be ruined and you will feel pain or any type of imbalances there. So you should also look into that, whether your stress levels are normal, and also you should you should manage your thing, because you're going for physio, and after doing that you're recovering, then you're coming to your regular regime. Then again start, something is disturbing your regular lifestyle changes should be done. Your postures, your food intake. See, potassium rich foods like bananas, everything, potassium rich foods like tender coconut water, green vegetables and greens, everything should be included. So every area should be checked. Not only your exercise pattern, but also your stress level, your food. Refined food should be not the food that should not be taken as refined foods, and also the white sugar items, sugary foods, and the foods that are tinned foods, and tobacco, too much of alcohol. Everything has an effect on these type of things. So overall check should be done. So only if you're taking some physio and you're coming out means that won't help. After some time, if the root cause is not clear, that will again start. So main thing, that's what I told, when you're lying in a resting position, when you're taking rest during this time, you should think over the root cause of your thing. So that you should only understand, you should only can diagnose that one, not even a doctor or someone else. You know where you're affected. Either it may be your mind or your body or particular position or the type of work you're doing. You have to go through that and you have to diagnose that one. And when you're correcting that one, it will be okay.
Thank you. Thank you so much. Yeah. So now we will take the question. You can just share first. Okay, I do stretching daily in the morning and keep active myself daily, but after some hours, again, my back muscles spasmodic.
Yeah, actually, you have to take care of your, again, I'm telling your stress level. So root cause. This is not the thing because you're stretching, it will go. It is going because, but again, why the spasm is coming? The root cause. What is the root cause? You have to look into that area. If you are able to diagnose that, then the issue is totally relieved. You could come out of it. Exactly, you could come out of it. You could manage it. So you are the person who could do that one.
And one more thing, Yogi.
Overstretching will lead to back pain. So when the muscles are overstretched, they get tired. So at first you will feel relaxed. So you have to have someone to guide you in that one. So you shouldn't do it seeing a YouTube or something, because each one's body is unique. And so you should have some person to assist in that area.
Yes. So Yogesh, it is like कि आप दिन में एक ही बार खाना खाते हैं, नहीं बार बार भूख लगती है, you eat on a regular interval. Like the same way, if you are someone who is just stretching in the morning or doing some breathing technique, thinking that I have done this 10-minute breathing technique and or stretches, and now I should not get back pain, and you are sitting for some long hours, 7-8 hours again on the chair, of course you will get the back pain. Yeah. You have to manage it throughout the day. You have to see, am I getting now, become aware that if when the pain starts initially itself, can you be aware that and point out that why I'm getting this? Is it my stress level? Am I shouting on anyone, or am I sitting for long hours? They're like little bit, and it builds up. What we usually do is we do not become aware, and when it becomes a lot of stress and lot of pain, then we crib. Usually we crib and we say, oh, a pain again, now let me put some hot water. Especially women has this tendency of keep on doing the work or keep on standing or keep on sitting. Anything in exaggeration you will do, you will end up having pain. Yeah. Okay, another question is, ma'am, is this pain is autoimmune disease, and what is fibromyalgia? Sorry to ask again.
Yeah, I'll just tell you. See, what is autoimmune disease is that when your body cells, that is immune cells, starts fighting against your own cells. Actually, what happens is when some foreign particle enters into your body, your immune system will work. It will fight against your white blood cells. WBCs will fight against those. They are the soldiers who are keeping you well. So they'll fight against that foreign body and they'll make you well. So that is your immune system. But here what happens, autoimmune means your own immune system is fighting against your own body cells. They are thinking that your body cells is a foreign particle. So today, most of the diseases are due to autoimmune. Example is thyroid, BP, sugar, everything. Most of the diseases are psychosomatic. They are called psychosomatic. And this psychosomatic is psycho means mind, somatic is body. Due to the stress level in the mind, that is reflecting in your body. That is psychosomatic. So this is called as autoimmune. Here, your body doesn't know, it confuses, it gets confused. Okay, it gets confused. Yeah, you can get rid of this autoimmune disease because if you understand that and if you correct your stress levels, you'll surely come out of it because it has happened. See, when a system is clear, when you're born, you're normal, everything is normal. So it happens, something is happening to you because of some type of thing you are doing. Some mistakes we are doing in our lifestyle, food, or anything like that. So it happens. When you correct that root cause, surely you can come out. It may take some time, but you can come out. When you're proceeding towards it in a correct direction with the correct people, you can come out of it. Yeah, that is called as autoimmune. And fibromyalgia is that your body, what muscles are getting weak due to this autoimmune disease because your body cells are working against your own muscles. So muscles become weak. They're confused. That's what I told. Getting stressed once or twice in a day, that is normal. But the whole day you're stressed, your immune system gets actually confused. To fight against whom? Who is your, against whom you have to fight? So what will happen usually when a foreign particle is entering, it will ask your brain, it will go to your spinal cord, that message, and it will go to your brain, it will ask, then it will give, then a fraction of a second happens. It will tell, yeah, you form this T cells, you fight against this one, you form this combination, you fight against that foreign particle. It happens and yeah, our immunity saves us. But when stress happens, for the full day, your brain gets tired and this is called a spinal reflex. Your spinal cord won't send the message to the brain itself. It will take its own action. It will determine, then it will take, yeah, full day you're stressed, so it is happening again. Why should I ask the brain? So it will take action. It will perform the action of giving the fighting thing full day. Adrenaline will be fright or flight situation the full day. All the day through, you will be having a production of adrenaline. So what happens? Your system gets confused. See, when you're overworking, when you're coming to your home, you'll get that irritation everywhere. Even when your child asks you for normal reasons. See, Mama, I'm feeling very thirsty. I want some food. But you'll get very much irritated. That is a very nominal question from a child. But when you're overworked, overstressed, you'll get very much irritated and you'll shout at the child. Same thing happens in your body. Fully I'm making it very much stressed. Your mind is very much stressed. And your body is confused. With whom to fight? Always fight and flight means with whom? No foreign particle is found. So what happens? It fights with your own cells. So which cells, which is already weak, genetically weak, because we have a genetic pattern, 50 from our father, 50 from our mother. So which part is actually weak? We have that genetical pattern we'll be having. So in that area will be affected soon. So you'll be affected with that one. So that's what happens. That is called as autoimmune disease. And that disorder also can be recognized.
You have very well and detailed explained, wonderful explanation about autoimmune diseases. I hope everyone has understood this autoimmune diseases. If it is clear, just message here clear, right? Then the next question is, when should one go for a back massage? Because sometimes back massage helps a lot and sometimes it makes the pain worse.
Yeah, that is very, very good question because...
Very good question, yeah.
Yeah, because sometimes what happens, we'll make it worse by doing some massage. That has to be done with the right person who is well-versed with massage techniques. That person must do that. See, when already your herniated disc is coming out, and already there is a compression on it and you're feeling pain. And again, you're massaging on that, what happens? You're making it worse. So that is the thing there. So you have to understand which type of pain you're having, the reason for your pain, and you should go for the right people, for the right massaging people also. That would help. That would help to recover also, worsen also. So it is better not just to go for massaging at the first itself. First, go through the thing, what is happening, what is the root cause, and will that help? Then go for hot or cold packs. That won't affect you much. But massaging is not like that. You are applying pressure on that area. So that will affect a lot. You have to take care on that area.
So can you share some, like how can people identify the back pain, though they are having, but what kind of, is there anything they need to figure it out? Is there any tests are there? And what are the mudras you would suggest, or what are the, in our day-to-day life, what is that we can do, some acupressure things and that you can share with us, because you have done a lot of things, batch therapy. Maybe you can enlighten us about that also. We would love to know. Are you all ready, guys? Shall we? Yeah. If you want to learn from her more, just message me here, learn. If you are ready to know more. Bring it on, BIO. Very nice. Okay. Thank you. Thank you so much. Let's, please continue, Priya. Before that, I see here one or two questions. Let me just quickly take those also. Can chiropractors really makes a huge difference? Does it help chiropractors?
Yeah,
it does.
The correct person will help you. Yeah, you can go for that one.
Yeah, and the next is I have been having pain in the back of my thighs, like pins and needles pain. So is it beginning of the sciatica?
Sure, yeah. That is due to your S5. So when it is at the back, at the lower back and the thighs, backside of the thighs, it means that your S5 nerve is being compressed.
Okay, hope you got the answer, Natalie. Yeah. Okay. We will continue. As of now, we will just take questions a little later. Let us first finish what ma'am has to share with everyone of us. Yeah, go ahead.
Yeah, now we'll be going with the mudras relating to the pain.
Yes.
This mudra is not only for back pain, but any type of pain you are feeling anywhere in your body. I'll just give a little brief it with the mudra. See, we are made up of, our body is made up of 5 elements, Panchabhutas, land, water, air, fire, and space. So 5 things. These 5 things are represented by the 5 fingers in our body. So if any of these 5 things increases or decreases below a particular level, it reflects in our body as disease. Okay, any disease can be managed, or that can be cured even, mainly using these mudras. We are using it very less. Actually, Siddhas from our very ancient people, they have used only this type of things and they have cured a lot of diseases. Even now, it is curing. In my experience, I've cured a lot of diseases using only hand mudras. It helps a lot. So going for the pain, this ring finger represents the earth element. Ring finger is for earth. Then little finger is for water. Your thumb finger represents your fire. Index finger air, and middle finger is for space. So 5 fingers: earth, water, fire, air, and space. Okay. So
how many of you are feeling confused in learning this?
Yeah, for first time you feel confused.
Yeah. I tell you one thing, if you know this, okay? This is how I learned. May I share? Priya, can I share that?
Yeah,
how
sure,
did I
sure,
learn
sure.
this?
Yeah, sure.
Okay. So how did I learn this? If everyone might have, so jal, thal, pavak, that means there is a saying, na, jal, thal, pavak, gagan, samira, panch tattva se banahu sharira. Okay. So I have learned it like that, that starting from the little finger, jal, thal, and then pavak is your fire, that is the thumb, that is the most important part. And then rest 2 come back Gagan, that is your sky element, and Samira, that is your air element. That's how I have learned. I hope this small trick will help you. So that is all. Jal Thala Pavaka Gagan Samira, Panch Tattva se bana hu sharira. Yeah, continue, Priya. By the
Yeah.
way, did you find it useful, guys? Did you find it useful? Just do it. Otherwise, just write it on at the tip of your finger for some time. It should help you. Yeah, go ahead.
Yeah. Then what is the thing is, see, in Siddha therapy, what they say is when Vata, body is divided into three types, Vata, Pitta and Kapha. We all know that one. So when Vata increases in your body, pain increases. Any type of pain you are feeling is due to the Vata that is increasing in your body. See, if you are feeling pain at your lower back, in that area, Vata is increasing. The space between the two bones, there Vata is filled, air is filled. So increase in air leads to pain in the body. So what we are going to do is reduce the Vata in the body simply by using your hands. That is the thing we are going to do. See, if you're having some headache, some pain here in your shoulder, anywhere. So now what you're going to do is, for decreasing, we usually keep our fingers under your thumb. So while decreasing an element, this is air element, this is fire element. So fire is common. For balancing a element, we'll just touch the tip. For decreasing, we'll just keep it under the thumb, just press it. So keeping the other three fingers straight, you're just reducing the air element in your body. So within 10 to 20 minutes, you will feel the decreasing of the pain. Even for periods pain, you can have this one. Anything. See, but the one thing is, here you should not have any gap. You should just keep on pressing until it is closer as much as possible. For the first time, if you're doing, you'll have some pain. But when you're doing it regularly, you'll get the practice. See, if you're not able to do a mudra, it means that that particular element is not balanced in your body. So in both the hands, you have to keep this mudra. This is called Vayu mudra. Just keep and press it with your thumb finger. Yeah, both the hands.
Yes.
Only one of this, for this mudra, one exception is that you can keep it even in one hand. If you're working in the other hand, if it is an emergency, you can keep it even in one hand, only for this mudra, not for others. You can keep this even for, even after eating food, even during a walk. Whatever you're doing, you can do this mudra. This is the one that is very exceptional. This is called as painkiller mudra also. And
wow.
Yeah, and this mudra is also useful for ulcer. Persons who are suffering from chronic ulcer or gastritis, starting off ulcer, acid reflux, everything this helps. It basically cures from the root cause. So any type of mind syndrome, mind stress or mind thought, negative thought leads to a physical disease. So when that is cured, your disease is cured from the root cause. So this mudra is doing that one. It is clearing at your mind level. So this is the thing. Yeah, even bloating will be reduced. You will get burps.
How long we should keep it?
You can keep it for 10 minutes to 20 minutes. So you can keep it for any type of timing, only for this mudra. Otherwise, 10 to 20 minutes, other mudras. This mudra you can keep for any time, because when you can keep this and you can lie down until your pain vanishes. Then just have it in your hand. So no timing for this mudra. You will get burps. When you keep this mudra, you'll get, within 10 minutes, you'll get burps. All your bloating will go away. Even lying down, you can keep it. Yeah, Bhargavi, even in lying down position, you can keep this mudra. So this is for pain. Any type of pain, you can keep. And also for bloating, everything like this. Migraine, yeah, it also helps. There is a separate mudra for migraine, but this mudra is the basic thing for each and every pain. It will reduce. It will reduce. Yeah. Then the next thing what we are going to see is acupressure massage for the spine health. For your upper to lower part of the spine, we are going to see a massage. See, in Sujok acupressure, what is the theory is full part of the body is reflected in your hands, both the hands. This is your head area, this area, and these two are your hands, and this one is these two are your legs. So this is your whole body. This is your head. These are standing with your legs, see, like this, and both these fingers are your hands. Yeah. If you're keeping like this, you can easily connect to it. So this is your abdominal area from here to lower abdomen up to your legs. Now this is the area, organs in that area, or the reflex points here. If you press here, you will have the recovery there. So when comparing to that one, no, this is your hand. So this area, that is your trunk. This is your body. I told you, no. This first line is this area that is attached to your trunk. Okay. This second line is your elbow, second joint. The third one is your wrist. So 3 lines. These 3 joints represents your 3 joints. Okay. So this one is your left hand and this one is your right hand. So when you're taking your left hand, this is your left and this is your right. And when in the center 2 fingers are your legs, I told you. Same thing. This area is your lower spine area that is attached to your body. This area, pelvic joint here. The second one is the knee joint. The third line is your ankle joint. Okay. Yeah. Now this one is your head area. This is your face and this is your neck. So this is your face area. So now what we are going to do is in both hands, same thing. Now just massage 5 times clockwise and 5 times anti-clockwise. Regularly, daily, for 5 minutes in the morning and 5 minutes in the evening. Just you have to sit and relax while you're relaxing. You're just massaging here. So this area and this area, everything is normal. Your pranic flow, your joints are all stress is relieved, everything here. Then this index finger. While you're massaging your index finger, your hands are massaged. All the energy.
I hope people are doing. Yes, both the hand massage. Okay, 5 times clockwise, anti-clockwise on your left, and 5 times clockwise and anti-clockwise on your right.
Yeah. Then coming each and every finger, just 5 times clockwise, 5 times anti-clockwise. That's all. Here also. This is your backside of your hands here and backside of your legs on the other side. This is the front area. So you have to massage. That's all. Simple. Clockwise, anti-clockwise, both the hands. And this one also, same thing. Clockwise, anti-clockwise. 10 fingers, daily, morning and evening, 5 minutes. It will take just only 5 minutes. You can just watch a TV, just do something else, just massage. That's all.
As we are talking, I hope you all are massaging.
Yeah, do it now.
Just do it right away.
Relaxation.
Yeah, do it.
Yeah, you will feel the relaxation.
So we will start. Shall we do? Yeah. Okay, 1, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. Another finger, your index finger. 1, 2, 3, 4, 5. 1, 2. Opposite. 2, 3, 4, 5. Middle finger. 1, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. Ring finger. 1, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. मजा आ रहा है? Everyone is enjoying. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. One hand is done. We'll do quickly on another hand also. Yeah. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. Then your middle finger. 1, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. I'm really liking it. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Last. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Wow. Do you feel a lot of blood circulation? Your hands got warm nicely, everyone? Yeah? Yeah. How often we can do this?
Just twice, morning and evening, that's enough. This is like a
Nice.
regular thing, brushing your
Nice.
teeth, just making a
Yeah.
thing. It'll be like a habit. If you do it regularly, see one thing here, this is the main area for us because this is the joining area, whether it is hip or shoulder. So you should not do like leaving this part. Should go up to the this joining area here.
And
Yeah, you should not just make it very harsh. Just keep it mild and do it just relaxedly. Just do it. That's all. And see, the other tip I am giving is this is your both the legs I told you. So if you press it here, this area is your back pain area and this is your back pain area. So if you press it here, you will feel a pain somewhere, sharp pain, other than the pressing only at a particular point. So that is the main area that is affected in your body. That reflex area is there in your hands. So if that paining areas, if you are able to find it out, then just press it that one some 10 to 20 times daily. That will also help you a lot.
can kids do mudra?
Pardon?
Can kids do mudras?
Yeah, they can do. Actually, see, when you're in your mother's home, you'll be doing some mudra. So gestures in your hand, always you do. You keep this mudra. This is called Adi Mudra. So a child will be having the hand like this in the mother's home. So without knowing you're doing a mudra, you are doing. That is only even before man has started speaking, he just showed gestures. That is a type of mudra. So it automatically happens.
Thank you. Thank you. Thank you so much. Lovely, wonderful session here. I'm just going to share here the form with every one of you, those who would like to learn more from our panelists. I'm just sharing here.
Yeah. Finally, one more massage I would like to tell you for cough, dry cough.
Yeah, please.
Yeah,
yes,
instantly
please,
when you're getting because this is a flu season, people are getting cough and cold. Sometimes you'll be having dry cough that couldn't be controlled. You'll be traveling, you'll be speaking in a meeting like this somewhere. So you'll not know what to do suddenly. So at that time, what you can do is just give a massage here. This is the lung channel in acupuncture. Starting from the inside of this one, this thumb finger here. See, from here. Can you see now? This is your thumb. I'll show in this hand. This is your thumb.
Okay, just see.
From here, from the tip of this finger here, from your nail to both the colors are joining. In that area, your lung channel is traveling. So from here to your wrist, you have to massage from the lower part of the wrist. Just give a massage like this for 15 times. You can use your thumb finger just at any one of your hand. You can use any of your hand, right or left. Then just massage here for 15 times. If you massage this one, instantly your cough will stop. Dry cough will be arrested at that time.
Awesome.
So that is the emergency thing. You can use it.
Nice. Very good tip. Very, very good tip. Hope you all are loving the session, guys. Do you find the session useful so far? Wow. Very useful tips. Thank you so much. Thank you so much.
Thank you.
Okay, so are you all ready to learn some breathing practice that can help you further to improve your spinal strength and, the muscles that are attached, as Priya has shared, that, it is not just we say that spinal stretches, we are worried about the spinal pain, but the muscles around that, if they are weak, right, you will also tend to have pain. So, and of course, your spine is like a double S. If you see here, there's one, here you can feel, the curve inside area here, and then at the mid back, you have a curve. So these are the two curvature part that we have. So our spine is a double S curve. So shall we do some breathing practice?
Sure.
Shall we do rejuvenating lungs? Yes. Can you share some, Priya, if you have any mudra for rejuvenating lungs, you can share. Yeah.
Yeah.
Excellent. You all loved it. Okay. So let's do some breathing practice also, everyone. And this is the practice I want you all. You can do it in sitting as well as in standing position also. Preferably, I would like that you do it in a standing position, but learn it today. So bring your hands first. As a ritual, always we start any breathing practice with the spinal stretches. We'll do some spinal stretches as regularly we do. Interlock your fingers, everyone. Okay, palms facing outward and take your hands up. Inhale, stretch your arm up. Exhale, turn over your right side. Inhale and exhale on your left. Inhale, center. Exhale, right. Inhale, center. Exhale, left. Inhale, center and exhale, bend over your right side. Inhale, center and exhale, bend over your left. Keep pressing your right hip bone on the floor. Inhale, center and exhale, bend sideways. Focus on your breath. Inhale and exhale. Now both the palms above your head nicely. Inhale, twist over your right side. Bring your palms on the floor. Your left palm holding your right knee. Yeah, I don't know whether you'll be able to see, but yeah, your left palm holding your right knee. Okay, you will hold like this and you will twist. Look back. Inhale, come up and exhale. Other side. Your left knee hold held by your right palm and twist back. Other hand on the floor only. I'm using the wall here. Take your left palm above your heads. Inhale, stretch your arm up. Exhale, bend sideways. Inhale, center. So everyone, those who keep doing sitting job a lot, keep doing this. Exhale here. Inhale, center. Yogesh, I know one. Exhale. Inhale, center. And exhale. Yeah. Inhale, come to the center and relax. So after always, when you do practice, give yourself a little relaxation also. Yeah. Now we will start with spinal cord breathing exercise. When you are doing it when standing position, make sure that your feet are firmly on the ground. Keep a distance apart. Keep your feet around hip distance apart, shoulder width distance apart. When you're sitting again on the chair, make sure that your feet are not hanging. Your feet are well supported. अगर आपके feet hang कर रहे हैं, put some blanket or anything just below your feet, make sure. Okay. Now sit upright, press your sit bones nicely, bring your both the palms in front of yourself, make a fist. Okay. Thumb inside and other fingers over that. Elbows in front. Yeah. Inhale and lift yourself, spinal stretch. Open up your chest nicely. Exhale. Round your back. Inhale. Open up. Keep opening up. Exhale. Round your back slowly. Be very mindful when you're practicing this. Inhale. Lower back, mid back, upper back. Feel that stretch. Exhale. Round, lower, middle, upper. Inhale up. And exhale down. Inhale up. And exhale down. Bring your hands forward and down. So this we have done frontal part. You can do the variation also. That means you can do keep a equal breathing, inhalation and exhalation. You can do 4-4 breathing pattern or 5-5 breathing pattern also. Other thing that you can do is you can do the sideways also. Okay, you can do the sideways also. That means the same thing. Inhale, stretch sideways, exhale, come to the center. Inhale, stretch sideways. Exhale, center. Inhale, up and sideways. Exhale, center. Inhale and up sideways. Exhale, center. Relax everyone. Keep your eyes closed. And now just observe of your practice, the impact of your practice, how you're feeling, how your breath is. Do not hold your breath. Just breathe, relax. Observe your spine, very, very important. Are you falling forward a little? Palms over your knees, facing to the ceiling. You can now choose a mudra that ma'am has shared with you. You can choose this mudra, right? Keep your palms over your knees and breathe. Focus on your breath. Your chin is parallel, shoulders down, sit bones pressed nicely. Spine is neutral and erect. Facial muscles completely relaxed. Take a deep breath in and expand your belly. Exhale, belly goes in. Inhale and expand. Exhale, belly goes in. Inhale and expand. Make it effortless. Exhale in. Without being forceful, inhale and expand. Exhale in. Breathe in and breathe out. In, out, in, out. Inhale and expand. Exhale, release. Feel as if you are releasing all your aches and pains. Inhale, expand nicely. Strengthen your body and mind. Exhale, release all your stress, worries, anxieties, pains. Inhale and expand. Deeply oxygenate your cells. Exhale, release the carbon dioxide. Inhale the fresh, cool air. Exhale, release the warm, heavy air. Feel that. Inhale and exhale. In and out. In and out. Inhale, full attention over your breath. And exhale. Inhale into your belly and exhale. Breathe in and expand. Breathe out, release. Inhale and expand. Breathe out, release. Just continue breathing at your own pace. And just observe which all muscles you are engaging. Are you engaging a lot of your lower back muscle? Is your spine moving or it is neutral and erect? Your chest, your collarbone muscles, are you moving your chest? Just be aware first. And how can you just focus on your belly movement and rest of the movement, especially your chest, are not moving at all or very less micro movement? Only the breath that is moving in your body. And as your breath naturally moves into your body, natural expansion and contraction in your belly region, just focus on that. You're moving into a deep, relaxing, rest and digest parasympathetic mode that activates healing abilities, that helps your cells to rejuvenate, heal. Take a deep breath in and have this intention. I'm breathing in, exhale, I'm breathing out. Inhale, I'm breathing in. Exhale, I'm breathing out. And with every exhalation, feel as if your facial muscles, any tense muscle area is getting deeper and deeper relaxation. Take a deep breath in and expand your belly. Exhale, release. Inhale and expand. Exhale, release. Inhale and expand and hold your belly. Keep yourself relaxed, shoulders relaxed. Do not choke yourself. Exhale if you feel like. Facial muscles completely relaxed. Exhale, release. Stay there. Just observe the impact of the breath work practice that you have just done. How do you feel now? Just be aware. Now become aware of the space you are in, the objects around you, the contact points. Take a deep breath in and breathe out. Breathe in and out. Now bring your palms to the heart center. Rub your palms. Take it to your right. And you can gradually open your eyes with a gentle smile. Take a deep breath in and stretch your arm. As you breathe out, bring your palms to the heart center, shoulders roll back, and just say, I'm grateful to my breath. I'm grateful to my healthy body, mind, and soul. I'm grateful to this whole universe. Thank you all. Thank you so much. Stay blessed. Breathe wellness enough. You all can open your eyes with a gentle smile. Thank you so much, everyone. Before I uh, close the session, I want to share something with you that there is a good news for every one of you that you may forget what you have learned. So this is the YouTube video link. Yeah. Thank you, Reena. Thank you so much, everyone. So yeah, can you please share your session feedback? Very quickly, I want to know first, how have been your breath work practice? Do you feel relaxed? First of all, were you able to relax yourself? As ma'am also said that relaxation is the key, right? Relaxation is the key. Have you felt that? Were you able to relax, or you are still in that fight and fight mode only? Yeah. So did you relax yourself? Yeah, great. Super relaxed? Awesome, everyone. Yeah. So connect to us. I have shared the form. I hope you have filled. If you have not filled yet, please do fill that. Super relaxed. What a Sunday. Great. So this is a YouTube video link. So I want every one of you to please go and share your 3 biggest learning. See, we are doing so much in sense that we truly want people to be healthy. And that is the reason we both have come together. We have taken out time for you. And what we expect is nothing else. It's a free session for you. Can we expect this one small thing, that we would be very happy if you share your learnings on this YouTube channel, and please do share it with your family members. Spread this awareness. We are doing so much, but if you and help us to just spread this awareness. That is all I want to share. I hope this makes sense to every one of you. Thank you so much. Yeah. So everyone, just I'm giving you 2 minute time. Please go there and share your learnings. If anyone wants to come on the spotlight, like you can raise your hand or just message me here. What have been your learning? I would like to bring you here very quickly. I can take 1 or 2 person. Yeah, because we'll close the session now. Thank you so much. See here, if you put thanks, it will be a waste because it's a Zoom session. If you put a thanks on a YouTube, it will be there with us always. Yeah. So this is my humble request to every one of you, that please do that. We will send you the recording again in your email also. Don't miss that. Yeah. Thank you. Thank you so much, everyone. Yeah, this last question is there. Can you please give a mudra for rejuvenating lungs? Anything for the lungs? Definitely, ma'am, will do. Thank you. Thank you, Reena. Yeah.
Yeah, we will go for that one. So people with lung problem and people with wheezing, asthma and flu, common flu also for them, and people without any problem also, or people with fever along with flu. For each and every one of these things, you can practice this mudra. See, this is called as Linga Mudra, and you have to check your breath before doing that one. If you're having wheezing or asthma, at that time, just check your breath. Which side your breath is little coming very less. See, if I'm having, my left side is now coming very less. My breath on my left side is low. Right is dominating. So that side of your thumb should be raised. That side of your hand. So my left breath is low. So I am now keeping my thumb finger of my left hand just raised. Now using your right hand, the first 2 fingers, you have to just touch like this. Just surround your thumb finger with the next 2 fingers. Then just clasp all your fingers. Just hold it. Just keep it like this. Can't see? Now can you see? Yeah. See, this is my left finger, thumb finger. With the right first 2 fingers, thumb and the index finger, you should surround it with your other hand. Then just join your all the fingers. Just interlock. Here what you have to do is, this area, the inner area, should be airlocked. So that what happens here is, this is already you have seen that thumb finger represents the fire energy. So you are increasing the fire energy in your chest area by doing this mudra. So while doing this one, your lung area is here. So by keeping this one, the temperature, the heat in your lung is increased. What happens? Any type of parasite, or any type of bacteria, any foreign particle that is there, that won't be able to survive at that temperature. So what will happen is all the phlegm that is already accumulated in your lower part of your chest, lung, that will melt and that will come out as mucus. So while doing this mudra, you should not take any medicine for stopping that one. This mudra, see, if you are doing any mudra, you can do for 40 to 45 minutes at a stretch. But in the beginning, don't go for at a stretch. So that you can do it for 3 times a day, split the timing, or 2 times a day. If you're doing for 2 times a day, go for 20 minutes. You should do it in empty stomach before your food. If you are taken food, just wait for 1.5 hours. Then you can go for the mudra. If you have taken anything liquid, after half an hour, you can do the mudra. If you have taken a solid meal like that, you have to wait for 1.5 to 2 hours. Now, you don't have to press it strongly, but you should not leave any gap in between. That's all. See, like that, you have to keep like this. So this, for holding this one for 20 to 30 minutes itself will reduce your wheezing. You don't have to take a puff. Just do this one regularly. People suffering from wheezing, asthma, you can get rid of that. You don't have to take anything else. So regularly, if you're doing for morning and evening for 1 or 2 months, you will not get the attack. It will keep on reducing. Once in a week you are having, then it will come for 20 days, 30 days. It will vanish. So what is happening is increasing the heat in your lung area. So any type of fever due to any cause, it will reduce after keeping this Linga Mudra. This has been proven in IIT Madras, and it has been proven with the photo. You are taking a photo session at your, before doing this one, and during the session of the mudra, and at the end of the session of the mudra, what is happening in your lung. That photography is taken for each and every minute, and it has been proven that in COVID, this has helped lot of people to come out of the this chest problem, a lung problem, and also it has increased the SpO2 oxygen level. People having 90, people having 85, it has increased to the normal level, and it will stay up to 6 hours. If you do this mudra and if your oxygen level is increasing, it will stay up to 6 hours. So you don't have to worry about that. So anytime if you're having any flu or cough or cold or asthma or wheezing, anything, you can just have this mudra. See, when during emergencies, you don't have to look after whether you had food or timing, anything. You can just keep it until you're recovering. During emergency, don't have to even look on your breathing also. For ladies, you can go for left side. For gents, you can go for right side breathing, right hand. Otherwise, just take a note of your breath. Just hold it. That's all. See, if a person is in the ICU, they can't keep like this for hours together or for minutes together. So for them, what we can do is, you can just keep, see, I'm having a low breathing thing in the right side. You just keep, for example, see, my right breath, the nostril breath is very low. So I'm keeping it here. Then, yeah, the left one, I'm keeping it down. Just keep it like this. Hold it like this. That's all. You don't have to keep this position and all. Just keep like this. Don't leave any gap in between. You can also tie with the help of a towel for patients who are not able to do this. They can just keep it here and then sleep. Keep it this side or this side according to your comfort. They can keep it on the chest, anywhere. So that would be of great help. Even during dengue fever, it helps a lot. But only during dengue, what happens, the temperature just rises 1 or 2 degrees, then it will reduce. In other fevers, it will start reducing. Only in dengue fever, it will start increasing 1 or 2 degrees. You don't have to be afraid of that. Then it will reduce automatically. So this will, this very, very proven mudra, and also this will also help to clear your lung, because why your lung is not having the full capacity means your lung is clogged with mucus in the lower area of the lung. You don't take the deeper breath. So you have to do some breath work. You have to do some regular breathing work. Along with that, if you do this mudra, all the mucus accumulated there, that will melt and then come out. So you should not take any medicine during that time. Then automatically your lung capacity will increase, and everything related to your lung will automatically increase. The oxygen capacity and everything, the breath holding capacity, everything will be Good.
Thank you so much, Priya. It was such a wonderful and informative session. I hope you all find it extremely useful, valuable, guys. Can you just message here, valuable? Yeah. Can you just message here, valuable? Yeah. Rina, breathe, first of all, okay? Thank you.
Thank you. Thank you all.
Yeah, someone has asked, it is important. My son is having asthma problem. Yeah. So
Yeah.
this can be done for asthma, this mudra that you have just shared, right? Yeah.
Yeah, sure.
Lot of value. Okay, so if anyone has not yet filled the form, I will just share it quickly. So that yes, everyone, those who will be filling the form, they will get a PDF ebook from ma'am. This will give you a great idea about the back pain issues and everything in detail. Whatever she has shared with you all, you will get a very detailed idea. I will just share here a quick glimpses of that so that meanwhile you fill the form, I will just share here with you. So this is the one you will get a
This can be
whole
done for
detailed
asthma,
idea
this
about
mudra
it.
that you have just shared, right? Yeah. Sure.
Lot of value. Okay, so if anyone has not yet filled the I hope you all can see here. Yeah. So you'll get a good, deeper understanding of this. Once you fill the form, you will be getting this. Yeah. Thank you. Thank you so much, everyone. Take care. Stay blessed. So I would like to give a gratitude, Priya. Thank you so much for coming in and being the part of this Health Talks with Experts. Means a lot for me for sharing your knowledge and wisdom, and I know that I am very feeling wow. I have learned a lot of things from you. Wonderful knowledge you share, and we wish you a great future. And we will certainly stay connected. Yes, I will be keep bringing you because I know that you have a lot of things to share. So maybe I'll invite you for my community sessions also sometime for some particular the things. So thank you so much.
On behalf of
Okay, so
my
if you have
side,
already submitted, Ganesh, then yeah. Sorry.
yeah, someone has asked me that
Yes, Priya.
they are taking medicines for lungs, that's lung related problem. Can we do mudra? Yeah, mudra you can do if you're taking any type of medicine, anything. Mudra is something related to your energy level. It is not on the medicine level. So allopathy or whatever medicine you take that one. This is working on your energy level. So it will support your system also. Your medicine, your recovery will be more faster than the only taking medicines. This I'm doing it even without having any mudras. Sorry, without medicine, I'm giving only mudras for curing. So along with the medicine also, you can take no issues. And on my behalf, I thank you, Yukti, and this is a great platform. And yeah, I'm happy in giving my knowledge to so much people, creating awareness, and you are doing a great job creating so much awareness and education on health side. It is a great thing and good karma on your side. Yeah, I thank you so much for this opportunity. And thank you each and every one of you who are staying here till now. And yeah, it's giving us a motivation to do more on this area. Thank you all. Thank you, one and all.
Thank you. So all the people, those who are there on YouTube also watching us live, I'm sharing here the form with you all also. Many have asked for that. So I have just shared the form here with the people who are watching already live. You can check. See, my only humble submission to every one of you, now that you have gathered a lot of knowledge, please apply that. ऐसा नहीं कि भूल जाओ. And you do not practice it. Make sure that you do the practice. So share with us what is that one thing that you will start practicing. One mudra, one lifestyle change. What is that one thing you will start practicing for sure? Maybe a posture correction, maybe something you should start. That is the only motive of us coming here and helping you and guiding you. So do you all promise us that yes, you will apply the learning that you have learned today? Promise me, both of us, promise to both of us. Just message me a P for promise. And those who are in my community, Wellness Abundance Hub community, make sure you go right away in the community group and share your learnings. I want a detailed learning. सबने notes बनाए हैं अपने, right? I want to see the detailed notes. It's a revision. Why I'm doing is because it's a revision that you will be doing, yeah. And rest of you, make sure that you do on YouTube also. Those who are in the group, make sure that you do. Go to Wellness Abundance Hub community WhatsApp group and please share your note so that others will also get benefit, and I will check. This is your homework, everyone. Yeah. Is there any community page? You can just do it on YouTube channel. Okay, Rina, go and do on the YouTube channel that I have just posted. Now, this link you can share your. Yeah. Thank you, Rashmi. Thank you so much. Oh yes. Uh, Wait, Priya, can you share your links also here with them?
Yeah, can you share that I've shared you already? Will you be able to do that now?
Okay, let me just quickly check out. I will just do that. Give me a sec. I must be able to. I'm just checking. Or if you have filled the form now, then you will get anyways in touch with the ma'am. I'm not able to see that somehow. Yeah. Though you have shared, but I'm not able to see. Earth ring finger. Jal thal. Little finger. Okay. Yes. Fire is thumb. Space is middle. Air is index. Absolutely right. Yeah. Thank you all. Thank you so much. Stay blessed. Breathe wellness in abundance. Take a deep breath in and stretch your arm. And as you breathe out, bring your palms at the heart center, shoulders roll back, and just say, I'm grateful to my breath. I'm grateful to my healthy body, mind, and soul. I'm grateful to this whole universe. Thank you all. Thank you so much.
Thank you so much. Thank you.
Okay, Ganesh. Sure.